All right, so in getting started with this, guys, I love getting to teach this to you guys. As I was preparing this, just wanted to give you guys a quick background on like why I get to do stuff like this. So I've wanted to be a chiropractor since I was 16 years old. My mom was a chronic headache and migraine sufferer, and between that and mental health issues, really sadly, she found an early grave. I was 15 years old when I lost her. My life was changed by a chiropractor a year later. I was in a really bad car accident. And after the car accident, I had back and neck issues. I was starting to develop migraines like my mom had. And the issue was that after 3 months after the car accident, I had the same problems that I did from the day after the car accident. I remember going to my doctor and telling him, hey, I'm still having these problems. And at that point, I wasn't referred to a chiropractor. He gave me a script for pain pills, which is what my mom was on for a long, long time. And I was saddened, and I was complaining about it at my lunch table, sophomore year of high school. And a kid at my lunch table was like, you've got to go see a chiropractor. That's what they fix. And my response was, what the heck's a chiropractor? Come on in, you guys. I was like, what the heck's a chiropractor? And long story short, I found my way into a chiropractic office. This guy took care of me. He aligned my spine. He explained to me how my nervous system controls healing. And it absolutely changed my life. I went then from there to Ohio State, where I studied undergrad. And one of my jobs at undergrad was I was a volunteer at the hospital. So I worked at the Ross Hart Hospital. I worked in the emergency department, and I was like a liaison. I would like take the people when they came in and enter the hospital, and I'd like walk them to their room or walk them into triage or walk them where they needed to go. So I got to walk around with people for hours. That's what I did for a lot of my undergrad growing up. And the really sad thing was this, is that anyone ever been in a hospital? Does it like wake you up real fast to like the world that we live in? So if I volunteered at night, it would be traumas in the emergency room, gunshot victims, people dying, what I would call fast deaths, right? Like they were traumatically injured. And then during the day when I would volunteer, I would see people come in with just all these just degenerative, debilitating conditions. People would come in with cancer. They would come in red, which meant they were like struggling with heart disease or congestive heart failure. I would see diabetes, people who had lost an ankle, lost a foot. And it was at that point that I was like getting just steadfast on the fact that what I wanted to do, what I wanted to help people with was in preventative care. Because anyone I talked to who was in the hospital, it was always the same story as I was walking someone. They would go, be glad you're young. I wish I were your age so I could do things differently, right? I wish I would have ate right, got my butt up and moved more, taken care of myself better. And they were at an age where, and at a disease level for a lot of them, it was too late to turn back the clock on that. But I looked at this massive hospital around me that was 12 stories high, that was filled with those people. And since my time at Ohio State, I've watched more than, 4, 5, 6 more massive hospitals go up, right? There was the Neuroscience Center a few years ago, attachment onto Riverside, that big giant thing on 315. And then at the mouth of Sawmill and 270 now, there's another massive hospital that's going up. I believe it's St. Anne's, who had a ton of money from tax dollars from COVID. And it's not that I hate hospitals or hate doctors. I work with a lot of doctors. But when it comes to a hospital specifically, what I always think when I pass one is that place is filled with a bunch of people who don't want to be there, but didn't know a better way. And they're probably in there 5, 10, 15, 20 years before they wanted to be. But no one ever helped turn those things around. And the reality is today we're talking about cancer, and by talking about cancer, we're talking about all the degenerative diseases, because cancer is not a diagnosis you get by itself. Cancer is the result of a sick body for years, if not decades. And so what I want this talk to be for you guys today is that you guys are going to leave knowing that, number one, you have resources. Number two, that you're not alone in working on getting healthy and doing this, and that we've got roadmaps laid out for you guys. Okay, we have a team of people here, now Dr. Matt, Dr. Jay, and myself, our whole team of help, to help you through this. And we're going to help you guys implement action steps so that you can feel rest assured that you're doing the right things to really get your body healthy from the inside out. Okay? I love talking and researching longevity, our ability as humans to not just be alive, but to experience great health. And it's kind of crazy. If you back it up just a few years, 1900, let's say 123 years ago, any guesses, average life expectancy? A hair under 50. Whoever said 50 or 45 was pretty close, okay? The reality is that like we've come kind of a long way in living longer in a short amount of time, which is a really cool thing. But when you think about what we were doing back in 1900, you start to realize that we're not actually doing a great job, okay? Back in 1900, we weren't oftentimes living to a ripe old age. We were oftentimes trying not to die of dysentery. You guys ever played Oregon Trail? Remember this screen? Okay, that's what I lived with growing up. So the reality is that we didn't even start. Here's a cool thing. 1900, we didn't wash our hands before surgery until 1865, right? So 30 years before that, we weren't even washing our hands before we were cutting people open, right? We're doing it on a dirty floor. So, give you guys some ideas here. When you look at it, one of the things that we've really seen a huge improvement in modern society is we've seen massive advances in engineering, in antibiotics, and in sanitation. And so because of that, we've able to really help ourselves in cutting mortality rate from infectious diseases, okay? Anyone know someone who's died of dysentery? Case in point, right? That's my facts on that one. But the reality is that if you take out the top 8 infectious diseases, things that we die very quickly from infections, our longevity hasn't changed much since the 1950s. So we've pretty much been stagnant for the last 75 years. And unfortunately, we've seen a lot of problems start to creep up as well. Problems of chronicity. We now have the highest rate the US does of all countries in the OECD, which is the top level economic countries in the world. So we have the highest rate of people who live with multiple chronic health conditions, okay? So when I think about that, I think about people who are alive, but probably not what? Living, right? They're probably not enjoying their life very much, okay? Our obesity rate, this wouldn't hazard you to guess it, is twice the average of the other top 20 countries in the world when it comes to terms of healthcare. To make problems even worse, obviously COVID happened, but even since before COVID, since 2014, the life expectancy in the US year over year has actually been going down. So what drives me crazy, and one of the reasons why we do this workshop in October is because, and it doesn't happen as much now, I don't know why, but up to a few years ago, I couldn't turn on the TV in October without seeing what on the screen? A pink what? A pink ribbon, right? October is Cancer Awareness Month, namely Breast Cancer Awareness Month. And one of the things that I would always see is spread awareness. We need to spread more awareness. And I'd walk a 5K, and I'd donate my $30 or whatever it was to spread awareness for cancer. The thing is now is that I think that we're very aware that cancer is a real thing, right? Just a show of hands, how many people in this office right here have had a friend, family member die of cancer? Show of hands. Okay, that's almost the entire room, right? So my concern now is that I don't think that we need more awareness. I don't think we need to spread more awareness. I think what we need to start working on is looking at what are the action steps, the implementation steps that we can take when it comes to beating this thing or getting as close to it as humanly possible, okay? When it comes down to it, this sounds grim for a second, but we're all gonna die at some point, right? So, but what we wanna try to avoid is leaving this planet too soon, okay? Growing up as a kid, I loved my grandparents, but I didn't get their wisdom until like my early 20s, like until I really realized that like grandparents were cool, right? And so I've got kids now, and I can't wait to become a grandparent, and I've got so much to teach my kids and my grandkids. But the problem for me was that by the time I was in my 20s and I was getting wisdom from my grandparents, only one of them was alive, right? And so in a lot of families that happens, right? Like we should be passing down wisdom and mentorship, and we can't do that if we're sick, if we're disabled, if we're in a hospital bed, okay? So part of this is knowing and understanding what the Four Horsemen are, okay? The Four Horsemen are the biggest reasons why we lose our lives early, okay? So these are heart disease, cancer, cognitive and neurodegenerative disease, and diabetes, okay? So one of the things that's kind of cool is in the past 50 years, we've actually done a really good job at understanding underlying causes of heart disease. So heart disease, when I was growing up and I was in school, heart disease was known commonly as the silent killer. Heart attacks and strokes killed more than a third of people who had them. And so we've made a long way when it comes to emergency medicine to help those things. The other ones, we're doing a terrible job when it comes to it. Almost every advancement that we've made in cancer treatment has been outpaced by the fact that we're getting cancer more often now. It's sad. And there's a lot of research, I'll go to this slide that shows this in a second, but there's a lot of research now that's showing we're getting at a younger and younger and a younger age, okay? And this stuff isn't new. We've known about cancer for a while. So it's been a long time, right? That was 52 years ago that he talked about that. Like I said before, the way it's going right now is still not good. We've seen a lot of cool advances in cancer detection and treatment. We've seen things like leukemia, Hodgkin's lymphoma. Those survival rates have improved a ton, but a lot of other cancers are getting worse and they've been diagnosed more frequently. So as a net total, people still die at the same rate as they did 50 years ago from cancer. There's no net change in it. And if you look at now, people younger than like older age, 45 to 64, middle to older age, more people die of cancer now from that age range than heart disease, liver, stroke combined, okay? So we're seeing these things happen at younger and younger and younger ages, okay? So the reality is that we're going the wrong way with it. And I think what it really comes down to is, for us, I think cancer strikes fear in a lot of us. It's something that, again, you don't obviously feel it in the beginning. You don't know you have it until it pops up on a test, most commonly. I think, and one of my best friends said this, the better we understand something, the better chance we have at reversing it or never getting it in the first place. But you have to have a good understanding of what it is for starters, okay? So I'm gonna show you guys a short video. This is like your fastest cancer education class you've ever gotten, ever. I thought it was really applicable and also helps us get done with this.
Cancer is a group of over 100 diseases characterized by abnormal, uncontrolled cell growth. In a healthy body, cells grow, die, and are replaced in a very controlled way. Damage or change in the genetic material of cells by environmental or internal factors sometimes results in cells that do not die and continue to multiply until a mass of cancer cells or a tumor develops. Most cancer-related deaths are due to metastasis, malignant cells that penetrate into the circulatory system and establish colonies in other parts of the body. Great advancements have been made, but cancer is still the leading cause of death for people under the age of 85. In the United States, 1 in every 4 people die from cancer.
So here's what we know, okay? So we understand that cancer is cells growing out of control inside of the body, okay? And after about 25 years of more intense genetic research, if you want to dig into the book, you can read Outlive by Peter Attia. What we found is that about 5% of the cancers that we have are genetic, meaning you were born with a certain type of gene where that cancer is completely unavoidable, okay? So it's 1 in 20 of them. That's bad. The good side of that is that, what's the other part of 5 out of 100? 95, right? If you're doing math at home. 95% of the other cancers are environmentally related or lifestyle related, okay? So good news there is we now have an understanding of what the triggers are. What we don't know is exactly what environmental trigger triggers exactly what cancer. We do, for example, for lung cancer, for example. Very commonly, it's people who do what? Who smoke, right? But we understand that there are tons of triggers that can cause problems, okay? So what now we understand, this is 50 years into the war, most experts agree on one thing. Although we've talked about race for a cure, trying to cure cancer, we understand wholeheartedly now that there will never be a cure. Ever be a cure, okay? The future of our society when it comes to cancer and staying healthy will be determined by 3 things, okay? The biggest thing is what we're going to talk about today, which is prevention, okay? It's the number 1 thing, okay? It's always easier to fix something before you get it or are diagnosed with it, okay? The other 2 things are understanding how to detect things early, and then I'd say the third thing is doing effective treatments, okay? Guess where all the research money goes into with cancer? Effective treatments, right? No joke. The amount of money that goes into prevention and education on prevention and research on prevention is the lowest statistical column of where cancer research and studies go. So if you think you're gonna wait for the news at 5 o'clock to be like, hey, today we're gonna spend 30 minutes on cancer prevention, I wouldn't hold your breath, okay? It's about what you can do, okay? So everybody say aye. It's what I can do, okay? So what do we understand about cancer? So we understand this. We understand that cancer, I'll move this over a little bit. We understand that cancer is at the end of the road of an adaptive survival mechanism. That's what experts now are defining it as, okay? So cancer is your body actually, believe it or not, doing its best to try to survive, okay? So I'll put this into an example that'll make it hopefully a little bit easier for you guys. So let's say I just passed out a big box of cigarettes right now and we all lit up, okay? For old time's sake, I never smoked, but maybe that's what people say, I'm not sure. So we're all smoking right now, okay? We know that the smoke inside of a cigarette has lots of carcinogens in it, right? It has nicotine, but it has lots of carcinogens, right? So that coats the lining of your lungs, and it coats the lining of your esophagus, right? Is that a good thing or a bad thing? It's probably not good, right? It's irritating, right? And so your cells get irritated, right? But you need your esophagus for lots of things, right? Not just inhaling smoke, you need it for chewing food and breathing air and all of those things. So your body will start to adapt to stress. The carcinogens that are in the smoke will start to kill your cells faster in that area, okay? And so your body's not dumb. If you start killing cells faster in an area, you're gonna start doing what? Ramping up production. Let's make more. Okay, you guys ever see someone who works with their hands? What do they have in their hands? Big, thick what? Calluses, right? If not, they'd be babies and they'd be whining and not going to work on time, right? So, but our body's intelligent, right? So the first step is your body says, wow, there's too much stress in this area. We're losing men fast. That's what I imagine. It's like the cell calling the brain. Like, we're going down here, we need reinforcements. They're like, all right, we'll send more your way. So they send more reinforcements to the area. So you get thickening in the walls of your esophagus, and that's called Barrett's esophagus. It's an adaptation, okay? If your body keeps having stress in that area and it can't keep up with it, your body starts genetically mutating, not just the cells, but it starts actually mutating itself. So what your body does is it says, well, we're falling behind. We're losing too many men out there. If we don't do something, we're eventually gonna erode a hole in our esophagus and we'll probably die. So what does your body do? It starts shutting off genes that code for cell death. So it says, I know you're injured, cell, but now's not your time to die. You got to go back out there. You know what I mean? Triage them, bandage them up, put an ace on their knee, go back out and get after them, right? And what happens is cells reproduce. And so if those cells now are genetically adapted and they've basically taken out their kill switch, those cells are now reproducing and they're already injured. So imagine like two injured people making an injured baby, right? If that made sense at all. And so now that injured baby is a wild child. That is what cancer is, okay? It's cells that aren't performing properly, that have lost proper communication with the brain, that are operating under their own individual government law, not following anything. And when those cells start producing out of control, that's what is diagnosable as cancer. So the unique thing to think about cancer is in most cases, if you didn't develop it, you probably would have died from something else. And that's where all the mindset is going now for it, okay? That's just one example, okay? So we understand that if that process will eventually lead to a clinically relevant cancer mass, but all cancer cells have a lot of things, have a few things in common, okay? So we're starting to understand as though there are more than 200 different types of cancer that it can be found in the body. They all have their own unique properties and principles. There's some commonalities that they all share. And when it comes down to understanding how to prevent these problems, getting an understanding of what a healthy cell is versus what a cancerous cell is, that's our way to preventing these problems, okay? So what does a healthy cell use? A healthy cell uses oxygen for fuel. We know that cancer cells do not function well at all in an oxygen-rich environment, okay? So when I think oxygen-rich environments, I think a person who's what? Exercising a lot. Right? So it's an oxygen-rich person. They're pumping oxygen to every cell inside of their body, okay? Cancer cells do not use oxygen for fuel, okay? They do what's called anaerobic respiration, kind of a nerdy thing. Cells that don't reproduce in oxygen make like 2% of the energy that a normal cell does. So when you breathe oxygen, your cells make energy. They make like 36 energy per cell. If your cells are in an anaerobic environment, they can only make 2 units of energy. And I was confused on this for years. I was like, well, why would a cancer cell not make energy? Does that sound weird, right? Like, cancer cells don't make energy. What do? I think this is fascinating. This is why I'm telling you guys. This is like the nerdiest thing I'll say all day, okay? So this is kind of interesting. So a cancer cell reproduces in an anaerobic environment with no oxygen because the byproducts of a cell reproducing in an area with no oxygen actually gives them the building parts and pieces to make new cells. Like they use the junk from respiration in a non-oxygen rich environment as like the building blocks to make new cells because they don't get it from the body. So they have to use their own environment to do it. It's weird, but a cancer literally creates its own microenvironment inside of the body, okay? So it thrives in that oxygen deprived state, okay? So when we talk about fitness, I want you to think back and say, oh, this is why he said fitness is important, is because cancer does not exist in an oxygen rich environment, okay? We know this. We know that people who exercise more have lower rates of cancer, okay? Healthy cells do not have to use sugar for fuel. They can burn sugar or fat for fuel. A cancer cell only utilizes glucose for fuel. That's in most all cancers, okay? Don't need to talk about it, do we? What do we all eat too much of, right? Healthy cell needs a proper nerve supply. A cancer cell does not need a proper nerve supply. We're going to talk a lot about the spine and the nervous system today. And the big thing to understand is that cancer can thrive in areas where there's not good neurological control. Okay, so we're talking if you damage your spine, if you damage your body and your nerve endings aren't working properly, if you have warning signs of nerve damage like pain, numbness, tingling, areas like that, those are areas where your body is not getting proper signaling from your brain to the rest of your body. Okay, healthy cell lives in a slightly alkaline pH. The pH of our body is around 7.4. A cancer cell either thrives in an acidic or a highly alkaline pH. Again, it likes to change its environment from the environment around it so it can reproduce. So it doesn't want this perfect homeostatic environment. It does better in chaos, okay? So here's the problem, is we're not living in a way that is commensurate with a good, healthy, long life, okay? By and large, if you guys drove here, how many fast food restaurants do you guys think you passed on the way? An unbelievable amount. Don't include gas stations, which is where I know some people actually eat meals from. Those things that roll. I don't ever know if people eat those. I just see that maybe it's the same taquito for 30 years. Who knows? But it's there. You know what I mean? So this was published in the Harvard Gazette about a year ago, September of last year. And I mean, the writing could not be clearer on the wall, right? In it, they said, we're seeing a massive increase in cancer risk in people before they turn 50. And we're seeing the numbers growing, meaning more people are being diagnosed every year, and the average age at which people are getting these cancers, those 14 different cancers, is going down. And they put right in the study, an altered gut microbiome, which means an unhealthy gut, lack of proper sleep, increase in alcohol consumption, highly processed food, sedentary lifestyle, environmental toxin exposure. These are all the possible culprits that we really believe are causing this 30-year trend of increased cancer. So it's sad to see that although we have more awareness of this than ever before, we're still going backwards when it comes to it. And now it's to the point that this has recently gotten to this number, 1 in 2 men, it was on the board here for the last few weeks, 1 in 2 men will be diagnosed with cancer at some point in their lifetime. That's half of half the room, right? 1 in 3 women, okay? We're a little bit behind you guys when it comes to being healthy. But the reality is if we know that this is what's going on in there, we can work on changing it, okay? If you look at any major institution, they mostly agree that at least 50% of cancer cases are preventable, at least 50. And if you think about the fact that 95% are caused by environmental problems, I'm like way inclined to think that's a low estimate, right? So what we're going to spend the bulk of today going through is how to change your lifestyle, okay? But I would tell you this, it's impossible to change your lifestyle without a big enough why, a big enough reason behind it, right? What I'm going to say are probably things that a lot of you have heard. I'm going to go a little bit more in depth on it. But the reality is that the biggest thing for changing is that you guys have to want to change, right? You got to have the can, you got to have the how. We'll give you the how and the what, but you guys have to have the will behind it, okay? So here's the 5 biggest habits that are contributing to cancer. Number 1, what is it? It's nutrition. It's our diets, right? It's what we're eating on a daily basis, okay? So here's some just quick hitters on this. We make up in our diets, 60% of our kids' diets, or of our diets on average, are ultra-processed foods. So 3 out of 5 of the calories that we put in our mouth are from an ultra-processed source. It's worse in kids, it's almost 70%. So if you think about like that 30-year trend that I saw, and then I look at what the food is that we're eating, like odds are we're still not going the right direction. You know what I mean? And we're the ones who feed our kids. So the standard American diet is what we call the normal American diet. There's a food group that we eat more of than anything else. You guys wouldn't even believe this. It's not vegetables. It's probably not fruit. Processed desserts are now the -- 1 calorically consumed food group for the average US adult. And if it's not you, it's the person next to you who's eating it. I couldn't believe when I read that. It's processed desserts, #1 food group in America, right? So we know that these diets contain too many calories, not enough healthy fats, that it contains sugars and processed foods that contain additives that contribute to cancer risk. We know that a poor diet disrupts hormones. We know that it affects your gut microbiome. And it's one of the biggest things that contribute to obesity, is an overingestion of calories on a daily basis, okay? We're gonna spend some time going over the anti-cancer diet or the reverse diet, but we gotta know that that's one of the biggest things that causes problems, okay? And number 2 is stress. Who needs more stress? Raise your hand, right? I do not. So stress can be a great thing, okay? Stress is our body's response to something we don't want to be around, okay? So if you didn't have stress, you'd be dead, because you'd be, drinking out of a pond or a stream. There'd be a tiger next to you, and you'd be like, "What's up, man?" Hopefully he'll sense my cool vibes and not attack me, right? You're not going to be here. You're going to be a statistic. So having stress, having that increase in cortisol is amazing, okay? We call stress our body's fight or flight response. When we are under stress, we're ready to fight someone, or we're ready to run from a situation in which we can't win, okay? That's what it's for. So short-term stress is amazing at helping us adapt to any environment that's around us. But long-term stress is extremely detrimental. Your body will never stop trying to fix a stressor. And that's the whole basis behind cancer, is that there is stress in a point of your body that you can't get rid of. And no matter what you do, you can't get rid of it. And so your body keeps trying to adapt and adapt and adapt and throw resources at it until either you adapt to the stress or you die, okay? So short-term stress, an awesome thing. But for all too many of us, we are stressed out for things that we can't control or can't affect. Talking mental, emotional stress, things that are way above my pay grade. I'm not a good counselor. I'm a very bad one-on-one coach, because I just look at people and I'm like, "Go do it." And they're like, "Well, I don't want to talk about it." I'm like, "No, just go do it." Like, but you don't understand. I'm like, "Just go do it." You can. So number 3. So the number 3 risk factor, sedentary lifestyle. All right. So I have a story about this. So I get to meet with patients every day who come into my office. And so this is purely anecdotal data for the first story. But anytime people come into my office, one of my biggest things is I want to get an idea of what their life looks like. So like we'll spend more time with people and we'll ask them beyond like, "Hey, what's your problem? How bad's your neck pain? What makes it better? What makes it worse?" We'll talk about it, because one of the things we want to get an idea for someone is, what's our shot at really getting you healthy long term, right? And it's different if someone has had a problem for 2 months versus if they had a problem for 20 years, okay? So we always like to ask backwards. So my favorite question to ask people is, have you been in a car accident before? And because I'm looking for traumas, and they'll say no. And I know that about 2% of my patients get in car accidents on a yearly basis. So 2 to 5. So I know that most of my patients have probably been in a car accident, just statistically speaking, right? So I'll ask them, I'll say, "Have you ever been in a car accident?" And they'll say no. And then I ask the same question again and they say yes. I say, "If you were to have been in a car accident, when would it have been?" And I almost roll my eyes now when I say it, because it sounds so dumb, right? And then they laugh and they're like, "Actually, yeah, so I was in 3. And they'll just start to ramble these things off, right? Every time. "No, I'm not in one." "If you had to have been in one, though, when would it have been?" "Oh, you mean that one?" "Yes, I mean that one." "That one, yes, thanks for not telling me." So the reality is that a lot of us have a sedentary lifestyle. A lot of us don't move as much as we should. But here's what I know. Having done this for 10 years, and Dr. Matt having 25 years of experience, and Dr. J several years of experience, is that there's a huge underlying cause to a sedentary lifestyle. And what I find is that it's at some point we got injured. This is for the majority of Americans. we get injured. We hurt our leg or our knee or our back or our neck or our arm or whatever it was, and it stopped us from being able to do the things that we were able to do, okay? That's the vast majority of people. And so I had this just feeling in my heart for the longest time that I was like, no, if we can fix those problems, then people can get back to being active. But I really thought it was just a personal observation. And the reason for that is over the last 10 years, I've read every book when it comes to longevity, understanding like prevention, and in every book I read, I get ticked off because I read a book and there's never any mention of chiropractic care or taking care of your spine or even taking care of your posture. Like even if they don't want to go down the road of chiropractic, because in the 80s, chiropractors and medical doctors fought, like even if they want to just give posture a bone, like that your posture matters when it comes to long-term health, I would have been happy. But for the last 10 years, every book I read, I finish it and I'm like, there's no mention of posture, ergonomics. I've written like 5 chapters on a book on it because I want to publish it. And finally, I pick up a book this year, and it's the first book I've seen that actually talks about the importance of ergonomics and posture and all those things. And it's dead in the middle of the book. And there was a study that the doctor cited, and it was that the vast majority of people who are sedentary comes from people who are injured and not healthy. And it's that thing is that we hurt ourselves at some point, and it's not like we're slowing down because we get old. We get hurt. So that's the reason. There's this underlying cause behind it, okay? So for a lot of us, it's lower back issues. That's in fact the #1 cause of disability in the US. It's the #1 cost to people as well. So meaning lower back issues cause us to lose more missed work days, cost employers more money in sick dollars, and it causes more bills than any other thing. Arthritis is #2, which is mostly in the spine, but it can be in any joint in your body. Heart disease is #3, neck issues are #4. So you look overwhelmingly that arthritis, which is caused by not moving or injury, back or neck issues, they're the vast majority of causes for issues, okay? So we have to work on that. And for a lot of you guys, I'm preaching to the choir because most of you guys who are in the room are our patients and are already working on those things. But it's just to go to say that that's like a really important place to spend your time and effort, is to try to stay ahead of those things, right? So the fourth thing is toxic exposure. I'm going to spend some time going through this. We know that we have toxins in our food, water, environment, home, cars, and more. The reality is that you cannot, again, this is one of those things, you can't wait on the government to tell you when things are toxic or non-toxic, because in order for things to get banned, they have to kill people, right? And so you can't wait on it. I'm going to give you guys some resources for understanding how to get rid of toxins. I've also made a video on it that's like an hour long, so I'm not going to go like an hour and a half into toxins here. Besides, you guys, like it's super heady and nerdy and not fun. So I have a video on it that I've shared inside of this note packet where the toxins page is. We'll spend a little bit of time going through that stuff today, but by and large, you're going to get a ton of it from a video that I put on YouTube just about a year ago that walks through it all, okay? Last thing, most of us underestimate this, is the detrimental effects of poor sleep. Anybody have kids in the office? Grown? Anybody have young kids? Who's young kids? You have young kids, right? Sleep's a precious commodity, isn't it? Isn't it? So it's the middle of COVID, and I go down to visit one of my friends in Cincinnati. He's also a Max Living chiropractor. His name's Ryan Berlin, and he's a great guy. He's got 3 kids, and I go down there. So my kids are 2 and 4. His are like 1, 3, and 6. Just a heck of a time chasing them around all day long. Well, 2 of his kids are like expressing some health, is what I call it. I don't call being sick because they're supposed to be being snotty if they're fighting something, right? So I say that they're healthy. So anyways, he and I are kind of like up back and forth all night, kind of catering to kids, mending them down, trying to catch up and talk, willingly foregoing sleep on our own end, which humans, by the way, we're the only species that does that. We're the only species that stays up late when we don't need to, right? But I hadn't caught up with him in a while, and I wanted to. So finally, I'm like, man, I got to go to bed. And he's like, okay, I'm going to go to bed too. So we go to bed, and I get woken up at like 3 a.m. by one of my kids. I put him down. I come back downstairs, and I swear to you, I've never seen this before in another human being. My friend Ryan is snoring and asleep, not on a couch, not on a bed, anywhere. He somehow figured out a way to lock his legs, and he's bent in half over the kitchen counter. And I mean, we had drank a little bit, but not enough to like, make this thing like a plausible reason for what he was doing. And I'm like, Rye, what are you doing? And he's like, what? And I'm like, do you want to go to bed? He's like, no, I'm all right. And I'm like, tell me you don't do this often. And to this day, he's the only human being I know that, other than like some of the horses I've seen, that like can sleep standing up. I didn't know it was like a thing. I have nothing to say about it other than like people, we don't sleep as well as we should. And that was like the weirdest thing I'd ever seen in my life. You know, according to the National Sleep Foundation, the average adult needs 7 to 9 hours of rest per night. There's a 1 in 1,000 shot that you can operate well on under 6 hours. Like there's actually a genetic thing that helps you function well under 6 hours of sleep, but it's 1 in 1,000. So when 10% of my patients tell me they get 5 hours and they feel fine, I don't believe them. The vast majority of them, right? Like that's 1 in 100 too many. But it plays a huge role in blood circulation, in healing. One of the reasons you need to be laying down when you're sleeping is so your adrenals get a chance to rest and repair. And so Ryan sleeping like a horse is not something that I would condone, even though he's a max living doctor and studies this stuff. I haven't read anything that says you should sleep bent over like that. But when we have insufficient sleep, it just raises our risks of everything, okay? Of cancers, of just lots of things, right? So you want to sleep and sleep well, and we'll talk about that more, okay? If we talk about the data behind this just for a second, if you want to like read more on this stuff for yourself, all of these things equate to one big thing in our body, and it's called metabolic dysfunction. Basically, we've gone so far from what homeostasis is that our body is continually trying to adapt to our lifestyle. So what that ends up looking like is that we have extra body mass that we don't want to be on our body. So in this, we call that truncal obesity. The research behind it is that if your waist is more than 50% in inches of your height, that puts you at an increased risk factor. So don't go by BMI, because you can have muscle and it can mess up a scale. But if you, let's say, for example, you have a 32-inch waist, you better be under 64 inches, right? And so forth going on up, right? So take your height, divide it in half, and if your waist is bigger than that, that's a big risk factor. We end up developing blood pressure problems from chronic malnutrition and from stress, high triglycerides from the same issues and lack of activity inside of our body, elevated blood glucose, which is an effect of having too much food. So our insulin, our pancreas is overridden and it can't produce enough insulin to get the blood sugar out of our body, and that causes its own issues. And then we start getting problems in cholesterol, okay? And so the issue I see is in like our standard medical care right now. You can have all these issues going on. You can be non-diagnosable as anything. You can walk into a doctor with these 5 conditions. They might say eat better and exercise, but they will not give you any specifics on it, and you'll leave there with a statin medication to get your cholesterol under control, right? And it's like sawing off the tip of an iceberg, in my opinion, right? It does nothing to change things long term, but that's unfortunately what we do. The reason I talk about this other stuff as well, like heart disease and diabetes and insulin problems, is because these are the things that drastically increase your risk of cancer, okay? So a lot of people end up dying with cancer, but they end up getting diabetes and they die of cancer. A lot of people don't die of diabetes, they die with diabetes, if that makes sense, okay? So there are ways to screen for cancer, and there are ways to get ahead of it. And I'm a huge advocate for early screenings. Like if you are at the ages where you need to get checked. I put a whole chart in there for you guys so you can do early screenings. I think they're amazing, and I think they're valid. I think they have one major drawback. You guys are probably all thinking it. If I go to a cancer screening and it's positive, the only bad news is what? I have cancer, right? That's the only bad news, right? So although screenings are great, they can only tell you once you have it, right? And the reality is when you are diagnosed with cancer, what we understand is that it takes a tumor, on average, 8 to 10 years to grow to the mass that it can be detected on a scan, right? So you're a decade behind it whenever you have it, right? And so there are lots of screenings now that they're pushing up because of this increase that we've seen in cancer. For example, colorectal screening, they want you to have it 10 years earlier than they normally did, but it hasn't changed, unlike the actual like charts that come out from your doctors. Prostate cancer needs to move up, breast cancer, lung cancer. There's some early research now, like they're really trying to get like something called liquid biopsies off the ground, which is where they can do like a blood test and measure for markers of different cancers, but they're finding that it's still not effective yet. And so the best screenings we have now are still going to detect cancer early-ish, but still way too late, in my opinion, right? Like we have to do more things to work on getting ahead of it, okay? So now we stop talking about all the bad stuff, and this is where we shift our mind and start talking about the better stuff, what you can actually start doing for it, okay? So one of the biggest things is test yourself, okay? Guesswork is not good when it comes to your body. You need to get data so you know if you're in the clear, in the bad, where you need to go, okay? So preventative lab testing. And when I say preventative lab testing, I say that because why? Most times your insurance won't what? Won't cover it, right? When patients come into my office and they say, hey doc, I had a blood test this year, I got my annual, will you look at it for me? They usually send me like 2 blood tests. And it's like basically checking to see if you have like kidney failure or if you have like acute infection, right? It doesn't test any of the other widespread things, okay? And for sake of it, I'm not gonna go into what each of these tests for, but here's a list of the preventative lab testings that you should do and have performed, okay? If you have an awesome doctor who will order them for you, great. If not, we can order them for you as an office, and they're not very expensive labs to order so that we can get an idea of where you are, okay? Your lipoprotein, this LPA marker, the ApoB marker, those are one of the best indicators for early understanding of cardiovascular disease. Still not run, unfortunately, that I've seen in any lab tests by generalized insurance during your yearly doctor visits, but those have been out for a few years now, maybe 5-10 years, and I don't know how long it'll take for the mainstream to get on with it, but they're the ones who did the research. So homocysteine is a great marker as well for cardiovascular health. That can look at nutrition and see like where your body is. You've got to know where your hormones are, men and women. I see guys who come into my office who have testosterone levels through the floor. Their imperative nutrients, their vitamin D levels are terrible, and they're not producing enough hormones to keep their body alive, right? So you've got to understand where your hormones are. And that's not just to say that you need to go to a men's clinic then and get tons of testosterone if you're a guy, for example. Like there are so many things that can be done to balance hormones naturally. Unfortunately, we swipe the problems under the rug for 5, 10, 15, 20 years, and then we want it better yesterday, right? So, but here's my problem with going to a hormone clinic and just getting a synthetic drug, for example, is let's say your vitamin D level is low. Who thinks vitamin D is important? You shall raise your hand, right? If your vitamin D level is low, just as an example in guys, it can lower your testosterone anywhere from 50 to 100 points, right? So let's say I go and I get a hormone panel, my testosterone's low, and they give me synthetic testosterone. Well, it fixed my testosterone problem, right? But the underlying issues that made my testosterone low, have they been solved? No. And so are you healthier? I don't know, maybe, but not all the way. You know what I mean? And so that's why I'm talking about this stuff, is you guys have to be educated on this. Unfortunately, in the world that we're in right now, there's a huge shortage in doctors, and I love primary care doctors. They're so hard to find good ones. And so you guys have to be advocates for yourselves when it comes to understanding where those things are, okay? So if you can get your doctor to order it for you, great. If not, we'll order it for you, okay? And you can do these things on a yearly or a semi-annual basis to make sure where you are where you need to be, okay? Blood sugar, okay? On our board for the last 2 weeks, there's a stat that's 1 in 3 Americans are pre-diabetic. 1 in 3. It's like 117 million Americans. It's insane. And that's for anyone over the age of 18, by the way, adults. 1 in 10 of them are diabetic. And we keep pushing ourselves to that limit, but unless you show up as diabetic on a lab test, full-blown diabetic, you're not going to get any early intervention. They're not even going to talk to you about it because they're so used to seeing it, right? That's unfortunately become the norm, okay, if a third of people over the age of 18 are pre-diabetic. So they look at you and they say, yep, your labs are bad. Go eat healthy and exercise. And you're like, how do I eat? How should I exercise? And they're like, bye, see you, have a good day. Okay, but we'll talk to you about that today. But these are the labs that are good to get done, okay? So for some of you guys, and some of you guys in this room have done these tests before, we offer more advanced tests now. So where all the new research is going, especially in the preventative space, is into what is called nutritional biochemistry. Everyone say biochemistry. Biochemistry. That is not the third word. Don't write it down, okay? But nutritional biochemistry, basically what is your unique nutritional makeup and need, okay? So now we can do labs where we actually look at you and say, okay, what's your level of mitochondrial health? The little things inside of your cells that make energy, like are those actually healthy or not, right? We can look at your toxin exposure and say, wait, do you have lead? Is it mercury? Like what is going on in your body. So now we can do simple at-home urine and blood tests that can give us these factors, okay? The way that I think about this is that with the new testing we have, we can find out that your body's not well 10 to 15 years before you develop disease, right? So if you can invest in these things, they're awesome resources to use, because now you can start really working on lysing those things and getting your body better so you never have to live with the diagnosis, okay? This is a metabolic test that we do inside of our office. We can also look at how well your body breaks down foods like fats, carbohydrates, and proteins. So a lot of people will say like, well, I'm eating the right stuff. You know, I'm even at a caloric deficit. Why can't I lose weight? We can look at this and tell you exactly why. Hey, you're not processing fats at all, right? Your body needs certain nutrients to break down fats. You're not getting them. So let's fix your gut. Let's give you the right nutrients, and that will help your body heal and get back to where you want it to be, okay? So really cool things that we have for you guys. This is a patient that I did testing on, and not here, just curious. Okay. He came into our office, and this is something that's crazy to me. He's had digestive problems for 30 years. 30 years. Goes to his doctors. He's a super healthy guy. Like, looking at him, he's like 65 now. He's like 12% body fat. He's got muscles, looks healthy. You know, his doctor looks at his blood test and says, you're healthier than I am. And so he doesn't know what to do. He's had colon scans. They can't find anything that's going on. We did his functional lab test and found out that his ability to break down fats was terrible. He was missing a couple nutrients, and he also had some toxicity issues going on. So we went through a protocol with him and helped him fix these underlying issues, right? And it's crazy. It's just certain supplements that his body needed to be healthy. And this is a guy who has his own farm, you know what I mean, harvests his own crops, is doing a lot of things right? And so we did this gut test on him, and it gave us those labs, and we start working with him for about 2 months. And he comes in one day and he's like, my favorite words, I'm regular, doc. Love hearing it, right? It's the weird things that we get accustomed to now. He's like, doc, I'm regular. And I'm like, that's so awesome to hear, man. He goes, I've been having GI problems. He didn't tell me this before. He goes, I've had this for 30 years. He's like, I told you it was a while. It's been 30 years, right? When you get healthier in one area of your life, everything changes. I had zero idea, again, that he had prostate issues. And his story after that was, he's like, they were going to do a biopsy on me. They were going to cut me open, and they said, if the biopsy is positive, I may get my prostate removed. You know what I mean? And to see that massive change in a few months, you know what I mean? It's just really cool. So we all got to decide at this point, like, what does your life plan want to be, right? Like, there's 3 different options you have in going forward with this, and I've heard this too from so many people growing up. I grew up in Texas, and my whole family down there, and I love them. They're like the best people to hang out with and have a beer with you'd ever want. But I mean, they smoke Marlboro Reds, they drink Bud Heavies every day, and a lot of them, sadly, were on the don't know, don't care plan, right? So it's like, I don't want to know what my issues are. When the good Lord's ready to take me, there I will go, right? That was their thing. Like, just, you let me know when you're ready for me. So right, so I don't know, I don't care, I'm just gonna keep doing my thing, right? Then there's a plan that I think is like healthcare 2.0, which is like, I'm just gonna try to find it early, right? Like, the earlier I can find it, the faster they can cut it out of me, or chemo me, or surgery, and there's times when those are necessary, but like, I don't wanna be in that road either, right? And so the last plan is something that you really have to get on the bus for, because you can't just limp into this, is I wanna do whatever I can. I wanna do all the right things so that I reduce my risks to never get it, right? And that's the plan I wanna be on, right? Because I've seen what sickness does to our families, right? I've seen the burden that it is if you're fighting a cancer diagnosis or heart disease or diabetes. You know, I saw my grandma lose her foot from diabetes, and you know, I see the toll it has on a whole entire family. It's not just you, it's everyone around you, right? And so the Never Get It plan is the one I want to help you guys get on, and that's why we have all of our essentials. So if you look to the right, they're all sitting there. We've had these essentials for years and years and years, and the whole idea behind it is that these are the things that we've seen the most research to support that helps you live not just a better life, but a longer life, okay? So a lifespan is when you are born to when you die. A health span is how much you enjoy that. So I'm all about having a good health span. I don't want you here with a pulse, but not really here. You know what I mean? So it's about enjoying that. And what we now know is that if you implement these things well into your life, it gives you the best chance of living long, healthier, and better overall, okay? So We're going to go through the keys to building a battle-ready body. The big thing to know is that if you guys leave this, some of these things might not fit into your current lifestyle, and that's okay. And it's okay to leave here and be a bit shooken up or be like totally overwhelmed. And it's all right, because sometimes you have to totally shake up your life. Sometimes we are doing things that don't serve us well. And I've done it before. I've gotten like addicted to a show or a sitcom or whatever it is, you know what I mean? And I have my wife come over and like flip my jar upside down and dump it all out and make me cry and like fill it back up again. So the reality is that like behind you, you see these rocks and pebbles and stones. The reality is you can fit everything into your life. I promise you can. I know people who are busier than me, who have more kids than me, who are healthier than me. And so therefore I have no complaints. I can't say anything. But the reality is that if you put the things that matter first, you'll always have time for everything or as much as possible, right? So what it doesn't mean is that like you can keep living. Let's just say you don't have a good lifestyle. Let's say you love watching 6 hours of Netflix. You've got all your shows that you watch every week. You know what I mean? Like you have a lifestyle that's based around that. Like you might hear this and go, well, that can't fit into that, okay? It's still what needs to be done for health. So it's either you decide, am I gonna shake my life up and put this in or am I not, okay? And as we go through this with you guys, we're gonna help you guys work on implementing this. That's what we'll do. Okay, so fitness. So it's best to start fitness and work your way into a program. Middle of COVID was going on and I was bored and stressed out of my mind, and one of my friends is someone I call a cookie monster. You know what cookies are online? Where like websites leave things on your page so they keep retargeting you. That's what this guy does, but with fitness stuff. He's super annoying. He was a D1 quarterback, went to the combine, decided to be a chiropractor instead of getting drafted. But he's like a 5-time Ironman. And anytime you talk about him, he's got some awesome race coming up, and he's always like, you know, if you want to join, you can join. And so we're in the middle of COVID, and it's me and like 8 of my friends were hanging out, and he's like, hey guys, there's a race in 7 months. It's an ultra marathon, by the way, and I've never run longer than like 12 miles in my life, and I was probably running from someone at that point. He's like, it's an ultra marathon. He's like, it's in northern Idaho. It's right on the Canadian border. We're gonna run across 3 mountain ranges, and it's gonna be a lot of fun. And I didn't really like realize what he said, but everyone was like, I'm in. And I was like, I'm not gonna be out, I'm in. You know what I mean? Like, it's all for better health, right? So this is Thanksgiving, and this race is end of June. And we leave the place, and I'm kind of thinking like, it was at night, no one's gonna remember this, like, just not gonna answer the text message. A week later, I get a call from a trainer, and I'm like, leaves a voicemail, and it's like, hey, it's Derek. I'm Ryan's trainer. I was just calling because he said you're in for the race. And so I call him back, and it's still like December 1st. Why is this guy calling me? And he's like, so I just want to talk to you about your training. You're not behind, but we have to start like this week to get ready for this training. And I'm like, okay, yeah, I can do some fitness, that's fine, you know. He sends me the workout guide. And it's like 7 hours of running per week on top of all the other things. Like it's like 12 hours of fitness a week. And I'm like, saying a joke, I'm like, I'm having trouble fitting this into my schedule. Like this is gonna be rough. So I start with it, and I hadn't ever run like that. And so like maybe what you don't wanna do is that, right? Like I ended up getting plantar fasciitis during the training. I hurt my back about 2 weeks out. So 4 days before the race, I got an MRI on my back to make sure my disc wasn't herniated. Then I flew 8 hours to Idaho. Somehow, by the grace of God, my disc healed, and I was able to run the race. But when I finished, my back was the only thing not hurting. I tripped over like 5 rocks. I tumbled. I was bleeding everywhere. I finished the race out of spite. Anyways, yeah. He had a heat stroke mile 24, and so he didn't even finish the race. So we were all jogging, you know. When we found out he was okay, we were all making fun of him because we're like, come on, man. He took the side door on a golf cart at mile 24. Anyways, that's not how you want to do fitness, okay? And research shows you don't have to, okay? Fitness is not about killing yourself. It's really about doing the right things, okay? So how do we look at fitness? Some nerdy stuff here, okay? How do we look at fitness? We look at something called VO2 max. VO2 max, simply put, is how well you can breathe. Sounds weird, right? How well can your body take oxygen and make it into fuel? That's how we look at fitness, right? Someone who has better fitness can make more oxygen into fuel. And at some point, this starts to get more and more and more important, okay? So when we look at helping you guys live to 75, 85, 95, 105 in great health, it starts to matter the physical shape that you're in now, Because guess what happens every year we get older? Does it get easier or harder? It gets harder. It gets exponentially harder. And what we're doing now, and there's a lot of like experts in this field that are basically trying to find out, like, based on your fitness now, it's kind of weird, but they're finding out like what your potential is to live to what age, right? So like if you're in this level of fitness now, we predict that you're going to be able to make it to 83 before you're completely debilitated, which is crazy to think about. But they're getting pretty good at it. They're basically saying like if you're 45 and you can't run up a hill for 2 minutes going 6 miles an hour and you can't complete that test, you're probably not going to make it past 80 in good health, just so you know, right? So fitness becomes important. Really, it's your body's ability to utilize oxygen. So whenever you can't utilize oxygen well, you become an oxygen poor environment, which is a breeding ground for heart disease, for cancer, for diabetes, for neuropathy, and for degeneration in the body, okay? The second important factor is having good muscle strength, okay? You have to be able to get jars open at the end of the day, all right? But on top of that, we need strength to fight the big defeating factor, which is gravity, okay? At the end of the day, that's gonna pull us down. So your muscle mass, and more importantly, your muscle strength, it's extremely important, okay? So when you're talking fitness, I don't want you guys to go, I don't know what to do. I'm gonna walk you guys through the exact protocols that are researched now to help you with living a longer, healthier life, okay? And it's probably less than you think. So aerobic fitness, okay? This is, I can talk while I'm doing it, but I'm a bit strained. So not walking with your friend, but maybe like jogging with your friend. This is known as zone 2 fitness. So your heart rate's up, it's elevated, but you're not dying, okay? As a start, your goal should be 2 30-minute sessions a week, okay? So if you haven't started at all, that's your new goal, is to get towards being able to do that. 2 30-minute sessions a week, okay? You wanna move your way to elite, best of the best. This means like living to over 90 in great health. 4 45-minute sessions per week is elite, okay? And I can do a chart for you guys too. Here's like fitness level. So this is like the top 97% is like here. And then this is like 75 to 95. This is 50, 25. And this is like the bottom, like 25. 1, we'll put 1 there, okay? So if you're in this top level of fitness, which we don't all have to be, right? This would be like your best chance at longevity, okay? And I mean real fitness, not like if you're like a roided out wrestler on TV, like that's not the same, okay? So this is like your best shot at living a long, healthy life, right? As you go down, it gets harder. So like this is very close to the best. You don't have to be the most elite athlete. We don't have to be like Olympic gold medalist to live a long, healthy life. But if you look around, true fitness levels, you want to be in this upper 3/4 based on your age, okay? If you go here versus here, your risk of dying early is 1.5 times higher. If you go to here from here, so like you're in the top quarter, just to like the bottom half. So like I'm kind of out of shape to I'm in really good shape. Your risks of dying early from degenerative disease are 2-fold. To go from this bottom part to this part, it's a 4-fold increase in your risk of dying early, okay? So we know these numbers. We know that the better fitness you get into, the less chance you have of dying early and of not enjoying it along the way. So it's important. So if you're starting out, 2 30-minute sessions a week, okay? Anaerobic. This is, what does it say? Can't talk, busy dying, right? That's the one where they say like if you can talk, you're probably not doing it right. Anaerobic is training endurance. And it's training your body's ability to break down fat. Anaerobic training builds muscle mass. It strengthens bone matter. So 1 20 to 30-minute session a week, okay? So 3 days a week of doing some fitness, okay? Strength and building strength, 2 sessions a week where you're taking your muscles to fatigue, okay? So building strength is not about doing 3 reps of 8 to 12 at this amount. Building strength is about one thing. It's straining on the last few reps. So it's all individualized based on you. You don't have to go out and bench 1,000 pounds. It's all about lifting something until it becomes very heavy to your perception, okay? So you want to get more muscles, you lift until it gets hard. And then you do about 3 more. Is that fair? Okay, just a simple, very easy way to put it, okay? I tell people don't count reps until it starts hurting and then count 3 to 5. That's your goal, right? That's gonna help your body gain muscle mass. As a side note here, please don't be concerned about getting too bulky. I've never met anyone who accidentally got in too good of shape. Like, I know sometimes we're concerned about that. I'm talking to you women where you're like, I just don't want to get too bulky, you know what I'm saying? Like, I'm like, talk to me about that. I've been trying to get too big for a decade. It's never happened. And I work out a lot. Unfortunately, it's never been the culprit of, oh my gosh, I got way too big. It happened. It won't happen, trust me, okay? As you build muscle, you'll burn fat, and it's gonna help a ton, okay? So, clean, whole food nutrition. I wanna make this with like some highlights of things as much as I can for you guys. We're gonna talk about the top 3 macronutrients, so your protein, carbs, and fats. Okay, that's mainly what we're gonna go over, okay? And I'm gonna just like make strong cases to change your diet to what I want it to be, okay? Protein, super important. Yes? Yeah. Protein's super important, okay? Protein does a ton of things in the body. And when I get into nutrition too, oh my gosh, there's so much disparities information. Can you guys agree out there on nutrition, what's good, what's bad? Don't eat eggs, the whites are good, the yolks are bad, okay? Fat coupled with tons of calories, coupled with sugars, which wreaks havoc on your metabolism. I'll show you here in a second. Fat calories burn themselves a lot different than sugar calories. Fat calories actually help speed up your metabolism, and you don't easily store fat because it doesn't spike insulin, which is the fat storage hormone, okay? There's an exception to that. Fat is easily stored when you eat tons of sugars. So like when you're full and you shove that like pie down, and it's just like fat and sugar, that's all it is. Like that's when your body stores more fat than anything else. High sugar, high fat tells your body it's winter's coming. We just had a harvest, let's put on food, okay? There's an adaptation that humans have that I wish we didn't. And the reality is this, and I think it's coming up in a slide or two. Where's it at here? This picture right here, human beings are built with a huge affinity to store energy. That's what we're built for. That's how we lived for a long time, okay? We've never had a food surplus until 150 years ago, where we could really store food in refrigeration, right? Like we have an unbelievable food surplus now. Like we are far more likely to die of overindulgence due to starvation, right? So eating healthy fat is really important, and if you're gonna eat lots of fat, not doing it with tons of carbohydrates is gonna really help as well, okay? Eating fat helps you burn more calories. This is why I say a healthy diet that's composed of a good amount of healthy fat. They've done studies on this, that people who ate more fat calories compared to the same number of calories from carbs on average burned 100 more calories a day, just from the constituency of what they're eating. So it's easier to keep yourself in a healthy diet where you're losing weight gradually or getting to where you need to be. If you exacerbate 100 calories a day from a healthy fat diet, over a year, that's a 10-pound weight loss, okay? And there's another really cool study on this. They gave 3 groups of people different types of diets. This is from Spain in 2013. They gave one group a Mediterranean diet, and they said just eat lots of healthy fats, oils, you know what I mean, all the stuff that you want. They gave another group, like they could only have 1 ounce of nuts a day. That was it. There was only a fat source. And the last group was like super low fat. Not unhealthy foods, but just very low fat. 3 years went by, and when they got the initial results, they had to stop the study for ethical reasons. They found that the people who weren't allowed to eat any fat, or hardly any fat, like they could have some from their foods, but not any extra fat like olive oil, things like that, they had a 31% increased risk of dying from heart disease in the 3-year study. So they stopped the study completely. We know that essential fats are important, and a lot of us don't get enough of what we need through there, okay? So if you are eating fats, the fats I'm talking about are the anti-inflammatory fats, also known as your omega-3 fats. Those are the ones you need to be working on getting more of. In an ideal world, we would eat 1 gram of omega-3 fats for every 1 gram of omega-6 fats. That's an ideal world. Next best world would be 1 to 4. So like 1 gram of omega-3s and 4 grams of omega-6s, that's decent. The average US adult diet is about 1 in 40. So when it comes to inflammatory fats, legit, we're like 10 times too high. So it's not the right fats to produce cells and hormones inside of our body, and that creates problems. There's lots of sneaky inflammatory oils that are out there, the seed oils. Your best sources of fat are the fat sources listed up on the screen. Through there, okay? So that's where you want to be looking for your sources of healthy fat. All right, so let's talk about carbohydrates, because everyone wants to know how much sugar can I have. Can I keep eating my good stuff? So carbohydrates, okay? I'm not saying that you can't have carbohydrates, okay? So when I say sugar's bad, I'm referring to totally sweet, nutrient-devoid foods. Your body needs carbohydrates to run. Your brain needs roughly 30 grams of glucose per day. So don't feel like you have to go here and leave from here and never look at a piece of anything that has a carbohydrate in it again, or else you'll die. So, but here's the reality, is most of us are more likely to vastly overconsume rather than underconsume carbohydrates. Very true, right? I've never heard someone that's like, I need to get more carbs in today, I didn't have enough. Doesn't usually happen, okay? We need to switch that, replace nutritionally empty foods with nutrient-dense foods, okay? So a lot of times the high glucose foods we're having are void of nutrients. That's what ultra-processed means, is the nutrients have been stripped out of that food. Okay, so you need nutrient-dense foods if you are having carbohydrates. This overconsumption is what leads to insulin resistance eventually, lots of stress in your pancreas, and eventually it's what leads to type 2 diabetes. We know that if you are obese, just on the BMI chart, it raises your risks of all cancers by 14%, just off of that. Significant increase in risk factor. So we got to get you guys on a good, sustainable nutrition protocol that helps you lose weight if you need to and keep your extra body fat low. Good carbs, bad carbs. There's a big difference, right? Sorry. Bad carbs are the ones with all the sweet stuff around it, okay? Good carbs, there's fruits, there's vegetables, there's even some type of grains and pseudo grains that are highly fibrinous, that don't spike your blood sugar a lot, that are awesome to have, okay? And I'll tell you this, the more that you work out, probably the more carbs you can get away with, just so you know. A little dangling carrot there for you guys, okay? But if you're not working out, if you have a low metabolism and you eat lots of sugar, you're gonna get a massive spike in blood sugar. And that over time is what will tear your arteries apart. So, the differences in vegetables, for example, starchy versus non-starchy, okay? Even just a case in point here, cauliflower versus potatoes. 1.5 cups each, huge difference in carbohydrates, right? I know a lot of people who are like, no, I don't eat any junk food, I just eat a ton of potatoes. I'm not saying potatoes are bad, but I'm saying if you are the person that's meat and potatoes and you're eating like whole ones every day and not working out and you're getting 200 extra grams of carbs, that will turn into fat, even though it's a vegetable. You guys with me? So your non-starchy vegetables are really what you want to try to get more of in your diet, get those massive amounts of fiber that help your digestive system and get you healthier overall. In your diet, you should really work on packing it out with nutrient-dense foods. So those are your high phytonutrient berries, so strawberries, blackberries, blueberries, raspberries, getting lots of cold freshwater fish into your diet that's packed with omega-3s, getting lots of cruciferous vegetables like broccoli into your diet, getting lots of spices into your diet. Spices are naturally anti-carcinogenic. You look at oregano, thyme, rosemary, turmeric. We need those herbs. Those herbs are extremely potent at helping kill bad bacteria inside of our gut, kill viruses. Turmeric, there's more than 600 studies showing it lowers inflammation in your body better than aspirin, right? And it's just a spice, and you can get it capsulated as well as a supplement, but really helpful at getting your body better. Citrus fruits, you need lots of citrus fruits, which are one of the places that, like, if I'm gonna get carbs, I'm getting them from citrus fruits, which are awesome, but they contain tons of vitamin C, and they contain a lot of bioflavonoids, which have been shown to help with longevity as well, okay? So packing your diet with these foods is really what you need to fill in. Those can be your stones, so to speak, and then you fill in the other stuff around it. And as long as you have a base of, this being 90% of your diet, go nuts on the other 10%. I don't have to know. Have your dessert, okay? People ask me all the time, like I've talked about ketogenic diets a ton, and if they're helpful or not. I do not think every single person has to be on a ketogenic diet, meaning you're only fats, zero sugars, healthy proteins. If you are actively fighting cancer, or you know someone who's actively fighting cancer, research does show that a ketogenic diet is extremely beneficial in people who have cancer. We know that cancer cells feed on sugar. What we don't know is that if a ketogenic diet completely kills cancer. So to say that if you're not eating sugar, you're starving the cancer, we'll go back. We think that cancer cells are going to find a way to reproduce in some way, shape, or form. But if you do reduce your sugar a lot, it helps to stifle the cancer growth, okay? So this is, it's like 13 different types of cancer they've studied. The vast majority of them, people have a better shot at getting better if they're on a low sugar diet, okay? So I would err on the side right now, if I was fighting this, to be ketogenic as much as possible. We still teach ketogenic as part of our advanced plan. If you have lots of health issues, cutting the sugar out completely is the fastest way to get back to health. It's just truth, okay? It's harder to do. Anyone ever do a ketogenic diet fully? It's a bit of a challenge. No one? One? Couple? Man, we need to, all right, everyone's doing keto for the next 30 days, okay? You're not leaving, lock the doors. But it can be beneficial, okay? Vitamin D, I'd be remiss if I didn't talk about it for a little bit. Vitamin D directly activates your immune system. So we know deficiency in vitamin D increases your risk for all types of cancers. Beyond that, if you're deficient in vitamin D, which is the sunshine vitamin, it increases your risk of bone fractures, osteoporosis, autoimmune diseases. You've got to make sure your vitamin D numbers are in check. So yearly, you should have your vitamin D levels tested. And especially as we turn away from the sun for the next 5 or 6 months, supplementing with vitamin D is what I think is really important as well, okay? We just don't get it in the amount that we need from the months of October until April. It's just hard to get, okay? For you guys, we have a bundle for you guys that just has all the nutrients that I think are the most important to have during this time of year. They're great to have in your arsenal so you get ahead of the seasonal changes that go on, where we have this whole thing called a cold and flu season, which I call like the hollow months, right? It's like Halloween, Thanksgiving, Christmas, New Year's, which is 4 days, but really like it's a 90-day bender for a lot of people. So the more we can stay ahead of that, the better overall, okay? Vitamin C, vitamin D, curcumin, which is really powerful. Our curcumin also has resveratrol in it. Resveratrol is one of the studied ingredients that actually extends lifespan. So the best longevity experts will take upwards of a gram of that a day. Ours has like 1/3 of a gram in it. So it's going to give you a lot of things that help extend lifespan, help prevent against cellular death. It also has quercetin, which is a super important ingredient that's been shown to help with longevity. And then max omega-3, which is your EPA and your DHA, your omega-3 fatty acids. All really important, okay? Part of our bundles for people who are doing the challenge, so I also put in there the first 2 ingredients for a really good smoothie, which is a greens powder and protein powder. So we're almost there. We're gonna go through detoxifying our body, and then we'll finish out with talking about taking care of our frame. Detoxification, okay? We know that, unfortunately, toxins are everywhere in our environment. We've done a bad job at I don't want to go too far down the road, but like limiting companies who pump chemicals into the environment. They have a lot of health effects on us. And unfortunately, carcinogens are often not banned until they've been shown to cause problems, because it costs our government groups millions and billions of dollars to fight them. And there's also so much collusion when it comes down to this stuff, it's not even funny. One of the best examples of that would be glyphosate. We've shown in so many studies that it causes cancer. Glyphosate is also known as Roundup. It's what's sprayed on a lot of our crops. I mean, by a lot, like almost all of them. It's a surfactant, so it stops bacterial growth on the crops, helps prevent against helps prevent against pests. The problem is a surfactant breaks up the chemical composition of cellular structure in our body. And so we, for all intents and purposes, have tons of research showing it's very probably a carcinogen. We're seeing people who have used it for years have multiple tumors all over their body. We always talk about the fact that the dose makes the poison, but in this case, I don't think it's something that we should be consuming a lot of. And if we buy conventionally raised produce from big markets, it's covered in glyphosate, unfortunately. It was supposed to be banned in 2022. They gave it a 1-year extension for 2023 while scientists were studying it more. So even right now, it is still not banned in any state in the US. It's banned in 4 to 5 European countries already. There are certain counties that have banned it for production of crops because it's blowing everywhere and getting people sick, but it still hasn't been banned yet. So it's just an example of showing that, like, tons of research, it's very, very plausibly a big carcinogen, and it's still not banned. And it is money, and it's from a massive conglomerate that probably has more money in lobbying than we could ever imagine. And so it's hard to ban these things. But again, I wouldn't wait for the 5 o'clock news to say it, because in the same time you see the 5 o'clock news story, you're going to see an ad at 9 o'clock that says, you guys know these ads, have you ever been exposed, your loved ones, to this chemical? You may be entitled to compensation without having to go to a court of law, right? Like, that's going to be the next line on there, is like, okay, now we're going to sue them back and play this whole game, right? But lives are at stake. So we know carcinogens break down DNA bonds, okay? The very beginning video talked about how inside of our cells are DNA. And whenever you have carcinogens, whenever you have stress inside of the body, you start breaking apart those DNA strands and your cells don't produce well. Well, that's what carcinogens do with this, okay? Unfortunately, and this is why I don't get into it, they're in all of our products. So the easiest way to work on taking care of this is to check cosmetics and cleaning products. And if you go to the guide I gave you, these QR codes are in there, and the name is there too, EWG. So EWG is the Environmental Working Group. They are like my favorite government industry, like my favorite government corporation, because their whole job is trying to test for toxic substances and try to get them banned. So I'm on their bandwagon because I think what they're doing is really noble, and they've gotten tons of substances banned, and they are people who publish like water reports. So you can go on their website and look at like the water for Columbus and see what kind of carcinogens are in the water. Shameless plug, probably filter your water. If you haven't checked it recently, we have like 7 or 8 compounds that are carcinogenic in Columbus City water that are above the EPA limits. So you want to just be on top of this. This company now has an app. There's 2 of them. There's one for cosmetics, there's one for cleaning products, and the app, you can open it in a store and you can now scan barcodes. And if anyone used it yet, it's super awesome. Like you can scan a barcode and it will tell you if it's toxic or not. And so it takes a little bit of time in the beginning to get used to it, but like once you start figuring it out, it really helps you eliminate the guesswork when it comes down to getting the right non-toxic, non-chemical products for your family, okay? So last thing we'll talk about is just the importance of taking care of your frame, aligning your spine, helping to heal your body from the inside out. I went on a tangent earlier talking about the reason why we don't do a lot of things. And when it comes down to it, one of the biggest reasons why we're disabled and can't do what we want to do is because at some point we get injured. And oftentimes it has to do with an injury in our kinetic chain. So you guys all remember the song as kids, hip bones connected to the... Thank you, yes, good. That was really good. I was waiting for someone to say ankle bones. That's all right. So we're all connected in this kinetic chain, right? And taking care of the frame is one of the most important things we can do, because if one of these components breaks, what happens to the rest of them over time? They all break down, right? They atrophy, they don't work well. And so when we think about our body, it's like the chassis of a car. How long should the tires on a car last? Like what, 60, 70, 80,000 miles? They should last a long time. With proper maintenance, they should last a lifetime for your car. The problem is that if we damage one of those tires and we shift the alignment and we don't do anything about it, you're going to go into the mechanic at half that mileage. They're going to say, whoa, you totally wore out your right tire and your left tire is bad. And while you're at it, you should probably just get a whole new set, right? They upsell you. And you go for it because you want the new tires. The problem is this, is if you think about that same analogy with our body, that same thing happens. We have the fall at age 6, and our parents tell us to walk it off. And then we get checked for scoliosis at 13 in schools, which they don't do anymore, and we make it under the radar because the curve in our spine is not big enough, so they say you don't have to do anything yet, which is intervention. In our 20s and our 30s, we started getting headaches, migraines, little stuff. We take medication to wear it off. We're 45, and we're finally like, all right, it's that time I have to go see a chiropractor. And we get x-rays for the first time, and I see this time and time again. We come into our office and we look at someone's spine and we say, oh my gosh, you have phase 2 arthritis here, you've got scoliosis here, your back, your hips are misaligned 2 inches, whatever it is. And people are like, well, I just started feeling this a few months ago, right? And it's like we think about it and we do preventative maintenance on our car for the entire life of the car if we want it to last a long time. But all too often for our bodies, and this is out of no thing for us, we're taking care of our families, we're working, we're providing, we forget to take care of ourselves. And we have breakdowns in here, it stops us from doing what we want to do. So one problem, like someone has a bad hip, turns into all the problems, right? And I can walk you through this vicious cycle because I've seen it so many times before. Let's just say you hurt your hip, for example, and you walk 4 days a week. How many days a week do you walk with a bothered hip? None, right? You don't walk. So you're at home. So do you feel good about yourself or bad about yourself? Bad about yourself. And when you feel bad about yourself, you're stressed. So do you want to eat healthy food or bad food? Bad food. Right? See where I'm going here? And so you bad food, so you have inflammation, right? Which puts more stress on your body, which makes you crave more bad food. And then that inflammation makes your hip worse. So you exercise more or less. Less, and then you're depressed. And then you develop more problems. And then you go from your hip hurting to your back hurting. And then your neck hurting. And then here's the really sad thing. You do that for years, and all of a sudden you've gained weight. You've put on pounds you don't want to have there. It's even harder to do the things you want to do. And you went from being so close to being healthy to now you're 18 feet under and you have no idea where to get up. And it sounds crazy, But the biggest thing that promotes us to start becoming worse and worse with our health is we lose one thing and we don't fix the cause. And unfortunately, in the medical world that we live in, we've become really good at taking our doctor's orders, which oftentimes is masking symptoms. And I can't stand it. I love pain medications and things like that in a crisis, but the problem is we've become so accustomed to doing things to take our symptoms away. And if our car had a check engine light, we'd never sit there and put a piece of duct tape over it and be like, all right, we're good now. You know what I mean? But you name the issue in our body, we can have neck problems and misalignment issues, like then we do that. But pain is a warning sign that there's problems. So normally in our spine, we should have healthy arcs or curvatures that support the structure of our spine. And from traumas, from accidents, from injuries, we start damaging the nerves that come out of our spine. That's what heals our body. So with the importance of getting adjusted in chiropractic care, you'll commonly hear us doctors say, the importance of chiropractic care is not to help you feel well. It's to help make sure that your body heals well. I go beyond that to say is that when we adjust someone and they feel better, it's not because we took your pain away. It's because we did something that actually helps your body heal through that injury. That's the reality of it, okay? So taking care of your spine is a really important factor, okay? This is one of the most oft overlooked things. We know that when your neck shifts and your posture shifts from a healthy position to a bad position, it puts a ton of imbalance into your body. So you're carrying weight like you shouldn't. So the first issue is that we have pain that stops us from doing what we want to do. The second thing is arthritis. And we know that a misaligned spine will degenerate or form arthritis faster than it normally should. Okay? One of the only ways to prevent and stop that from progressively getting worse is to fix the problem at the core and actually work on realigning your spine and keeping it healthy. So if you're a patient in our office, you guys always know when you first come in, we're doing all the things to correct your spine. And then at the end of that, we're saying, hey, you need to keep your spine healthy and keep it with adjustments, do your exercises at home. Because again, as we age, as our body tends to break down, what happens to our posture? Year over year, it starts to get worse, right? And that's a big cause for a lot of the problems that we have. So our big thing is we want to keep you moving as well as possible. We want to keep your frame as aligned as well as possible. And we want to keep helping your nervous system heal your body as well as possible. There's three huge components when it comes to getting chiropractic care and staying ahead of it. Is we want you to move well, we want you to be aligned well, and we want you to heal well and stay ahead of problems, okay?